Hello. This video provides an overview of matters covered in online training on practical challenges related to suicide. This training builds on earlier training called Dealing with Suicide Ideation. There is a video available that summarizes what was covered in that training. Ideally, you should view the Dealing with Suicide Ideation video before watching this one. This training session and the video deal with practical matters such as managing a GROW meeting should suicide ideation arise, how people in the group should be led and taken care of. The video is primarily about suicide ideation. Bereavement and how to support a group if there is a death is also addressed before we end. Most people, of course, never experience suicide ideation within GROW. A person dying is even more extremely rare. However, if you come up against either, knowledge about good practice and safety will assist. All of this training is based on two GROW documents, the quick guide on suicide ideation and the more detailed guideline on responding to suicide ideation as on the screen. Let's start with responsibilities. No one in GROW meetings has a legal obligation related to responding to and reporting on a person at risk of suicide. It's a moral responsibility, not a legal matter. Everyone present is obliged, though, to respect confidentiality. If you judge there is a risk of harm, a duty of care trumps the person's right to privacy, and you can discuss matters with emergency services, next of kin, etc. However, as the crisis winds down, the obligation for confidentiality re-emerges, and what happens should not be disclosed to others beyond emergency services and other involved professionals. Let's move on to how to respond during a GROW group meeting. Best advice is to temporarily stop the meeting. The person should be invited to a private space, ideally an adjacent room, and should be accompanied by two people. Support should be provided right away and should be guided by the ALGE framework as learned in mental health first aid training. Other members of the group should continue with the meeting if there are sufficient numbers, and they should be assured that the person is getting best care possible. You need to take care regarding safety. Provide support with another or others, not on your own. If you judge there is any risk of immediate danger, ensure that two people stay with the person at all times and do not delay in making contact with the emergency services and or next of kin. Something that can prove very useful in a crisis situation is to be able to provide emergency services with an air code for the location where you're at. You can do this if you have identified the air code in advance and if it is available to hand at all meetings. Someone from GROW needs to follow up and check with the person afterwards. They should be asked whether they have linked in to the support that is appropriate. The person should be encouraged to continue coming to GROW meetings. Also update them on any supports and resources, particularly local ones, that you may become aware of. You need to ensure that you or other GROW members do not end up negatively impacted by the experience. Talk to your area coordinator and use support such as the after-hours emergency support if required. You will probably need to update members who witnessed what happened with how things worked out, but do this in outline terms and remind everyone about the obligation for confidentiality. It is often worthwhile to talk through how the group dealt with the matter and to query if there are lessons to be learned. This is normally done at the next meeting. Now, let's consider bereavement and how a group can be affected by a member dying by suicide. This is very unusual. What seems to work best, though, is for the group to meet and to discuss and agree on what the group should do in response. The group may opt to do something in meeting or as a 12-step activity. Investigate what bereavement supports are available locally and inform all group members about these. It cannot be said too often that anyone who knew the person who died or otherwise interacted with them is not in any way responsible, and this message should be regularly resaid. The GROW program offers a host of wisdoms that can help someone bereaved, and those can be used as part of the middle routine in group meetings. Let's finish by noting that Spun Out has a very useful county-by-county list of initiatives that provide crisis assistance. You can use this list to learn about supports available in your locality. I hope this video has been of benefit.